We would like to thank your sponsor, Valley First, a division of First West Credit Union and a member-owned financial cooperative serving the Okanagan, Similkameen, and Thompson regions. They offer a wide range of banking and investment services for individuals and families. Valley First also has a talented business and commercial team to provide the expertise, products, and services local businesses need to grow and thrive.
Hello, everyone, and welcome to Business Matters, presented by Valley First, a division of First West Credit Union, where we delve into the stories and insights of leaders and change makers in our community. I'm your host, Rob Capello, and today we have a special episode featuring two remarkable guests from the healthcare technology sector. Joining us are Dr. Kevin Wade, co-founder and chief medical officer, and Jeff Van Dyke, CEO and co-founder of Gravitii, a company that's really changing the way we look at home care. So you guys, thank you for joining me today.
Yeah, thanks for having us.
Rob. No problem. So we're going to jump into learn about your guys' journey and what you guys are doing with Gravitii. But before we do, I'm curious, let's go back a little bit. And what inspired you guys to the creation of Gravitii? When was the aha moment that led to sort of the inception, and how did it all come together? You guys having coffee one day and go, hey, let's start this company. So how did that all come together?
For sure. Kevin, do you want to start?
Sure, yeah, I can start with that. I'm a palliative care physician in Victoria, and I do a mix of inpatient work, like in the hospital, as well as outpatient work through BC Cancer and in the community. And really, it was about hearing and listening to the stories that my patients tell me. So a lot of the people I look after are very sick, and a great many of them would rather be in their own home than be in hospital. And I have the privilege of, a lot of physicians don't get to see their patients both in home and in hospital, and I do. And understanding some of the things that led to them coming into hospital, which was that they weren't able to get sufficient home supports. Often their medical needs are well covered by, occasional clinic visits or seeing family doctors or seeing specialists and so on. But it's the actual, like the day-to-day care piece, what in medicine we call the activities of daily living. So, dressing themselves, eating foods, getting to the bathroom, getting bathed, all of those pieces were difficult for them to achieve. And some of that's done through the health authorities, and some of it's done through private healthcare or home care, pardon me. But the real challenge was that a lot of them weren't able to find someone who they could sort of rely on and have a direct relationship with. And I started to think that there was a way that we could sort of technologically solve that by building direct relationships with people. I don't have anything sort of a business or programming background, though, so it was pretty crucial for me to be introduced to Jeff as well through a mutual friend in Kelowna. And Jeff can probably take it from there in terms of our original meet cute.
Absolutely. Thanks, Kevin. As Kevin mentioned, we got introduced by a mutual colleague or friend who's in my McKay CEO forum. And when he mentioned that Kevin was thinking about this concept of a marketplace to match home care providers to patients, I was really excited. I had just sold my last company to a public company that was based in Canada, and I'd spent some time working with the new owners, and I was looking for a new challenge. And this was really exciting. I've been in software and running the business now for a couple of decades, I guess. I won't put the actual number down, but I've done everything from staff scheduling to patient scheduling, and then getting into health and well-being. So the opportunity to do something that has the potential to directly help and impact individuals was really exciting to me. So I was so stoked to hear about Gravitii. And then, Kevin and I had a chance to meet each other, and Kevin's an amazing person. He has an amazing background, and coming up with this amazing idea just felt like it was serendipity and just brought everything together. So I guess the rest is history, and moving on into the future.
That's great. And I love how you guys brought both sides together. Like Kevin, you were saying you need the tech side, and I think you guys had a great marriage there. So why don't you tell us about Gravitii? Who is it? What is it? And how is your approach different than maybe existing traditional methods that we have out there right now?
Sure. I guess where we're really different is that we don't hire care aides directly. We've built a marketplace that's similar to Skip the Dishes or an Uber. where we create a marketplace and use technology to create the connections and manage the business tools for the care aid. The kind of the premise is that we want to put more power into both the individual, whether it be a caregiver or a family member, or the patient themselves, to self-advocate for their health and their well-being. And then on the care provider side, we want to create opportunity for care providers to run their own businesses, the opportunity to earn more money, have more control over their schedules, and also have more control over their ability to do the work that they're best suited for, and provide the services that make the most sense for them. Kevin, anything you want to add to that?
Yeah, I'd say, just compared to sort of the traditional model of home care, usually people have a relationship with the company itself. They hire an agency, and then that agency just tries to find someone or anyone that can go in and provide care to the patient. And that creates a high amount of bureaucracy and overhead for the company providing that. And what that translates into is higher costs for the patient. The typical home care agency will charge the patient, somewhere between 2 and 3 times what it is that they're turning around and paying their health curator, community health worker. And to me, that just adds costs and adds difficulty. And the fact that their relationship isn't directly with the care provider means that there's less engagement on either side. One of the things that I like is being able to follow my patients longitudinally. And I wanted to try and share that and spread that with community health workers to give them some more autonomy and control over their careers. And also for patients to give some more autonomy and control over who it is that's walking through their door each day to help dress them or bathe them.
So how does that process work? Can you walk us through how does that sort of matching a patient to a home care provider? Like what does that look like?
Yeah, Jeff, that's sort of, I guess an algorithm question in some ways. So, I can certainly talk to what characteristics people are looking for, but I think Jeff can talk more through the
Sure.
details of that process. Yeah.
Yeah. It's using technology and all the amazing attributes of technology that we can apply. And Kevin talks about the algorithm, but I think it boils down to matching patients with providers that are best suited to their situation and their needs, and that can be anything from the activities of daily living that they need support with, to the location, or how close they live to available care providers availability, the types of skills or the types of services that care providers want to offer. And everybody's unique and everyone's personal, so we need to make room for the human element in that. We want to provide them with the options that we see that best meet their needs, but then give them the tools available to make choices based on their personal, unique, individual likes, wants, personalities, all of those things. So we talk about algorithms, but if we're doing our job right, the algorithms are gonna do their magic in the background, and nobody's going to notice that. It's going to feel like there's a really human process in place.
And is there all types of home care services you guys offer? Is there certain types, or is it all in not, I'm not that familiar with the industry, so maybe I'm using the wrong terminology, but is there different types of home services you can get for working with Gravitii?
Absolutely. Right now, we're focused on the registered HCA, which is a healthcare assistant or community health worker. We made that decision intentionally just to make sure that we have qualified, accredited professionals on the platform, and we're using that to help build trust with our market and make sure that we're delivering services that meet the medical needs of our patients. There may be opportunity in the future to open that up to more of a companionship approach, or I'm not even sure what the terminology would be for it right now, but things like helping with cooking or cleaning or transportation, or even just matching people if they have a need for just spending time with someone. But at the moment, we're really focused on the HCA, the care aid side of things, and then we'll expand that out.
So I'm curious.
The terminology. Oh, sorry, I was going to add something.
Yeah,
sorry. Yeah, just saying, like, the terminology that you'd hear in British Columbia is talking about what are called home supports. And home supports is something that's outside, like there's community health units that provide nurses and stuff. And we're not trying to to change that at all. This is more about the extra pieces that the government and generally sort of a lot of places don't look at as healthcare, but it's something that improves people's health by allowing them to be independent and remain in their own home rather than having to be either hospitalized or move into long-term care. Or for my patients, it's often the difference between being able to be in their own home and going to hospice.
So, and maybe this jumps into the next question, and is, what are the challenges you're seeing right now in, I'll say, modern healthcare, specific with a focus on home care, and the issue that, or the problem, or where you guys are addressing it and solving it? Like, and I'm sure we can take hours just talking about what your challenge, what you think the challenges are in modern healthcare, but maybe we speak around sort of the home care side of it.
Yeah, I mean, the central challenge is a demographic one, and that's something that people are facing. This is not a very much a sort of Western Europe and North America wide problem, that the population is aging and people are having fewer children to look after them. And what that creates is a health human resource challenge where there's not as many caregivers, care providers, I guess I should say, you know, and a lot of elderly people with care needs. In British Columbia, for example, now we have over 20% of the population above the age of 65. That number is only going up. By 2030, it'll be over 30% of the population over the age of 65. And so we're, you know, that demographic transition is a challenge for healthcare everywhere. I mean, I work in a hospital most of the time, and I know that we never have a free bed. You know, a free bed lasts maybe an hour, and then we have another patient come up from the emergency department, and the emergency departments are backed up with patients waiting for beds, and the hospital is backed up with patients waiting for long-term care. So that central challenge of demography, I mean, the math is pretty merciless on that. And the solution that we're offering is something where people can perhaps remain independent, remain in their home, and try to actually sort of, you know, thrive there rather than being institutionalized, whether it's to a hospital, to a long-term care setting, or again, in my case, to hospice, and allowing them to sort of have the extra care that they need, not necessarily the health care, because a lot of the time the central issue is more around frailty and a slow decline, whether it's physical in terms of frailty, whether it's cognitive in terms of memory loss or other forms of cognitive impairment. And it's not necessarily something that they're going to come into hospital and have fixed, like the traditional healthcare model, where it's like, okay, you get sick, you go to your family doctor, and if you have a crisis, you go to the emerge and they figure things out, and then you get better, and then you go home. That doesn't necessarily work after the demographic transition. Means that a lot of people have these chronic issues that aren't entirely fixable, that they just require more care, and we have to meet them where they are rather than continuously trying to fix them and just deal with the acute problem.
So you guys are fairly new doing this, right? Like in a sense, from Gravitii perspective. And I suspect that you're in an industry that doesn't necessarily change quickly, the health industry. So what has been the early adoption? Like, what are you guys, and I think, Jeff, I think you said like a month in Victoria or weeks, I don't know. Like, so, but just what's the initial reaction? Is it, are you being embraced by care providers? Like what are you feeling? What are you hearing right now?
Absolutely. First and foremost, the reception has been incredibly positive. Everyone we talk to seems to get the idea and love the concept. Our adoption rate so far has been really, really good on the provider side. You know, it's that was a little bit of a surprise, to be honest. We expected that market to be a bit harder to crack into, mostly because we recognize that there is a shortage of resources. But I think that speaks to maybe a change in society where people are looking for alternative ways of working and earning money and having more flexibility and more control over how they work. The patient side has had positive results as well, but has been a little bit slower to evolve. And I think part of that was that we started really focusing on building the care provider side of our marketplace first, to make sure that we had people to solve or people to meet the needs of the patient. So we're very early on still, so we're really working on building up our marketplace. But so far, I'm extremely excited about the reception we've had.
Kevin, how about, because you're you know, as you work in palliative care, how do you see Gravitii and maybe the technology impacting even just palliative care specifically?
I think the biggest thing that I would like to see is us to be able to deliver more care at home, and that means focusing in on what actually kind of matters to these people. That often we're able, a big portion of what we do in palliative care is symptom management, and often we're able to control symptoms. But symptoms are controlled, and people can get increasingly weak and frail and need help with those activities of daily living, where otherwise they wouldn't be able to be in their own home. I see people who come into hospital to have, even on the palliative care unit, to have sort of what we would characterize as aggressive symptom management, where we're changing their medications, we're starting infusions, we're doing things to get something like pain or nausea under control. And they get better, they improve. It often works very well, but they get better in the sense that they are now less symptomatic and more comfortable, but still not necessarily capable of looking after themselves at home. And I think traditionally that burden would have fallen to families and what we call family caregivers to look after them. And more commonly nowadays, we see family where either they don't have that support that they need, or their family is distant and people are a little bit more disconnected. So for me in palliative care, what I like and what I support is when people can be in their own environment and supported in their own environment. And so Gravitii is an attempt to kind of supplement what is already available. So, I mean, there are home supports available from the health authority. There's private home care agencies, but I've never found that to be particularly able to meet the needs of the patient that I see. And so trying to sort of square that circle and keep people in their homes for longer. And in doing so, like, it's not the objective of it, but the eventual outcome of that will also be that we have more beds available in hospital for the people when they do need that aggressive symptom management. Like if people are able to go home sooner because they can get somebody to help them to the bathroom at home, then they don't necessarily need to wait in hospital while someone else is at home suffering for that lack of a bed.
It's interesting. Do we consider Gravitii the future of home, like what you guys are doing, the future of home care? Like where do you see it going? Because it was interesting. I mean, in our industry, AI is big, obviously in the marketing world. And just recently I saw a post that a company assigned an AI robot to be their CEO. This is like real, like I'm not making that up. Like, so where do you see the future of home care heading? Like, is this it? Is this the future, what we're talking about today, trying to get people staying home, not going into hospitals, where maybe, is that sort of where we want to go, or where you see it going?
I absolutely think this is a starting point. There's a lot of talk. You're right about medicine being a very conservative world, and a world of skepticism, right? Where it's like, okay, well, this didn't work, and it takes 10 to 20 years to affect change. But I absolutely think that this is the start, and being able to support people with these simple, straightforward pieces to find the people that can help keep them in their home, and then after we do that, then you can expand that outwards and sort of down to over to different skill levels, having more and more nursing in the home rather than focusing on, okay, well, let's bring them into hospital to do nursing, and being able to keep track of people remotely. In the sort of more acute medical world that I don't work in as well, the corollary to that is what's called hospital at home, which is a huge growth area in both the United States and here, where we're trying to do more and more acute care outside the hospital just with remote monitoring. And I can see Gravitii being able to expand and assist those areas. But the fundamental shift here is trying to think outside the bricks and mortar of the hospital, and trying to think how much more can we do without somebody having to come into the emergency department, which is overcrowded and unpleasant and nobody wants to be there, and try to keep them in their home where they can be most comfortable.
Interesting.
I do think there's a role for that to expand outwards and eventually to be sort of the standard way that healthcare is delivered.
Yeah, no, I thank you for that. So, I mean, I love that you are pushing the envelope and not doing what everyone's done in the past. So I think that's, kudos to you guys on that. And I think that comes from a technology side too. And Jeff, I'm curious, like, you come with a technology background. How did you find marrying sort of technology in the medical field? Like that I don't know, I want to use the word transition for you. For sure. I know you had lots of experience, but how did you find that?
Yeah, I mean, I'm not sure how I ended up in the healthcare software industry, but once I kind of got into that field, it kept by hooks, and I think it's really just a personal endeavor to try and help improve the system in some way using the skill set that I feel like I'm best at, and that skill set has evolved from being just a software developer into being a leader and an entrepreneur. But really, there's truly an underlying desire here to improve the system, take a load off the system, make it more efficient. Whether it's from a scheduling perspective and trying to optimize scheduling to prevention and trying to keep people out of the hospital. And then ultimately trying to care for people when they need that care, and just affect and take that particular load off the system. I've talked to so many people, and I don't think I've talked to anyone that doesn't have a personal story, whether it's themselves, their family members, or a friend who hasn't had an experience where home care has affected them, has been needed, and in many cases, unfortunately, the experience was a negative experience, and we want to turn that around and make it positive, and at the same time just take a load off the system and provide better care for people in general.
That's great thing. And you guys right now are 2 locations, correct? You're Victoria and Central Okanagan.
Correct.
What are the plans? Like, I know we're early. You're like, we're just on Victoria, just like, but where are the plans next? Are we going to see services beyond BC or the rest of BC?
Definitely. Being from Kelowna and Kevin from Victoria, and kind of trying to marry the human and personal side with technology, it just made perfect sense for us to start within our home locations. We have our connections in the Central Okanagan and Victoria. We have boots on the ground. We can go and visit independent living organizations. We can talk to the doctors and the pharmacists and the seniors organizations and so on. We plan to open up to the rest of BC very soon, probably in the next week or two. We'll grow slowly through the rest of BC, I think, to start with, as we pick up steam. And then, of course, we want to go across Canada, and we want to improve everything across Canada. We're considering the US as an option. It's a different model. It's something that takes some analysis and some planning. But of course, it's a much bigger market than we have here in Canada. So there's lots of opportunity down there from a business perspective. So we'd be silly not to think about it and plan for it. So I don't have the timeline for that yet, but it's definitely in the cards.
What are you doing this weekend? No.
Well, this weekend, absolutely. I'm planning our BC launch.
Jeff, you spoke a little bit about sort of the why you do this, but Kevin, to you, I know you probably have a lot on your plate. It sounds like you have, in what you're doing. Why? What motivates you to do this? Where's the passion come from to actually really make a difference in the care side?
So I'll preface this by saying my background's in the military, and I got into medicine somewhat later. And so I've been a physician here in Victoria for 3 years, and then I was a physician for 5 years in Kelowna before that. Okay. I think I'll be, working in palliative care in Victoria for probably the rest of my career, and likely for, 20 to 25 years or so. And it is looking at the past, I would say, like the central, its challenge has been, over the past 3 years, our capacity issues have gotten worse, and I have a hard time seeing that changing. And I wouldn't want to be here doing the same work that I'm doing as a palliative care physician 20 years from now and sit back and think, I wish I had tried to fix something 20 years ago. And so I wanted to start doing something now, something to say, well, this is an opportunity for us to fix something rather than just continuing to get by, which it often feels like in healthcare. You often feel like you're just trying to get through the week and through till your Friday afternoon, or through the weekend if you're on call. And so wanting to build something, and something that would help the patients that I see sort of day in and day out, was really the central thing to bring me to this.
Interesting. Jeff, how about you? Is there something else you want? I know you kind of spoke a little bit about sort of the why you're doing this. Is there anything else you want to add to that?
it's just a great opportunity to bring multiple passions that I have together, from technology and building great technology to having or growing a company with an amazing team and phenomenal culture, and at the same time being able to help the healthcare system. It's kind of a win-win-win opportunity, and how could you say no to that? I'm blessed to have this opportunity.
So in closing, if people that are listening and, is there anything you want to share to listeners that maybe we haven't covered, especially, anyone that's either considering home care for themselves or for their loved ones? Is there something that we can kind of leave with them if they're interested in learning more?
Yeah, absolutely. We'd love to have a conversation with anyone that is interested or has questions. We're not the typical tech company that answers with robots that don't actually help you. We want to be there for everybody and help provide care. And we'll do our very best along the way. You have that as our promise, and we're here to do that.
That's great. Kevin, anything you want to end with?
Yeah, just that, we're here to help, and we're here to try and fix a problem for patients and for British Columbians. So starting to think about everything that we can do, everything that we can change. And for me, giving people autonomy and control and independence matters so much. And so if we can do that, even move the needle a little bit, then it's all worth it.
Amazing. Well, guys, thank you so much for joining me today. I think I love your passion, dedication to transforming home care through technology. It is inspiring. I know it's probably a little bit of an uphill battle, but I love that you guys are doing it. So thank you so much for sharing your journey and vision with us. And I'm hoping that people are listening just gives them a little bit of understanding on sort of the strides you guys are making in healthcare. So thank you for taking the time and talking to me today.
It's a pleasure, and thank you.
Awesome.
Thank you very much, Rob.
Everyone else, if you enjoyed today's episode, please leave a review and share the podcast with your friends. And for any feedback, please reach out to us. And until next time, thank you for tuning into Business Matters, and have a great day. Thanks, guys.
Bye-bye.
We would like to thank your sponsor, Valley First, a division of First West Credit Union and a member-owned financial cooperative serving the Okanagan, Similkameen, and Thompson regions. They offer a wide range of banking and investment services for individuals and families. Valley First also has a talented business and commercial team to provide the expertise, products, and services local businesses need to grow and thrive.